Hi, Ben Choder, and welcome to the mHealth Zone, and welcome to day 2 of the conference in beautiful La Jolla, right outside of San Diego, or basically it is San Diego. I'm really excited for today's show. My first guest today is Dr. Molly Coye, Chief Innovation Officer at UCLA Health System. Molly, welcome to the show. I got one question I ask everybody. What's your favorite app?
My
and it
favorite
doesn't have
app?
to be healthcare. What's something you can't live with?
Oh, well, right now it's MLB at bat. Are you kidding?
Okay. So are you a Giant fan?
I play both sides of the street between
Okay.
the Giants and the Yankees, but
Okay.
the Yankees went down.
I know,
I'm sorry. I'm
a diehard.
What am I saying, Yankees? I'm talking about the A's.
A's. Oh.
My son was a bat boy for the A's, but I've got the Yankees on my mind now.
I'm a diehard Yankee fan, and I was
I'm
rooting
not
for
sure
the
we
A's.
can go on with this
It's
conversation.
okay. Well, it was really nice meeting you. Hey, you have, tell us a little bit about your background and how you got to be Chief Innovation Officer at UCLA Health System. 10 years ago, was there such thing as a Chief Innovation Officer?
There wasn't such a thing until even shorter time. And really, it's up to everybody to define it for
Right.
themselves. We say it's breaking out like a rash now.
Right.
There are so many Chief Innovation Officers out there. And there are really two kinds. One of them try to invent new gizmos or
Right.
get them sold in the market. The other kind are really trying to transform care. So in the next 5 years or so,
Right.
we've got an affordable health
What kind are
system.
you?
I'm the second kind. I want to change everything.
In your role, you also lead the Innovation Healthcare Initiative. What is that?
It's basically finding the high leverage innovations. What are the things that could really transform care? We don't have unlimited resources
Right.
or time.
How are, mobile and wireless technologies, changing, and how's the quality of this stuff?
The quality of what's out there that's actually on the market
Right.
and has a significant number of customers is pretty good. And when you go with young companies, you just got to check it out. But it is the common platform for probably at least half to two-thirds of what we think has the most effect.
What do you think the future holds for the space?
I think it's going to become, on one level, a commodity. Everywhere, everything is
Right.
going to be wireless.
Well, that's a
And
good
so,
thing, right? If
yes.
it becomes a commodity,
Yeah.
we all did what we were supposed to do, right?
But then on top of that, the healthcare system is changing so radically that which products actually make it, which new applications, which
Right.
new services make it, is actually not, I think, is going to sort out pretty heavily, and it's not going to be what we see now.
So, like in UCLA's world, is a big driver, is it coming from staff, the C-suite, or is it coming from the physician? I mean, what's driving?
I'll tell you, it's mostly coming from the consumers. It's coming from
what I
our
wanna hear.
patients.
Right.
And it also comes from the young residents and the young faculty. They're all with it.
Right.
But it's, us in the upper ranges of the echelons in age that
So
put up
patients
resistance.
are coming to your clinical staff and asking about mobile?
I just did an interview a day or two ago for Men's Health magazine about tips, how to ask your doctor for your personal health record and how to get it set up.
Wow.
So, this is reaching corners that we thought you had to go through the doctor originally.
I guess sort of the analogy, sort of like 5 years ago, a patient would run into a doc's office with something they read in WebMD and say, "Hey doc, this is what I think I have," and a doc could actually say yes, no.
Right.
Now today they're sitting there because there's so much mobile health. The biggest problem is it's still the Wild West.
Yeah.
I guess they're looking towards their clinicians and looking to the innovation officers to help.
Well, I'll
define.
tell you, one of my favorite health apps is Visual DX.
What is that?
That's for docs,
Right.
and there's a consumer-facing version. But if you think you have something today, like I think I have psoriasis,
Right.
you have to go on and read all about psoriasis and decide, is that what you have? This walks you through what we call as a doctor building a differential. It helps you decide, well, it could be psoriasis, it could be this, it could be that. It helps you sort through all of that. And I think that's the future of apps.
Right.
They're going to help you figure your way through something, not just answer a specific need.
So, tying into that, so like in your opinion, how is mobile health technologies, improving quality of care?
Well, when we let it, when
Right.
we use it to its full extent, it means that patients can have the amount of care and kind of care they want right at home everywhere they are.
Right.
That the old idea that a visit to a doctor once every 6 months or once a year was going to significantly affect
Right.
your health is really being stood on its head.
Wow. So let me ask you a question. So it sounds like UCLA is a little bit ahead of the curve. But how do we get healthcare institutions to adopt this? I mean,
Well, I'm going to show my colors here because I think health reform is going to do this. Health reform with small letters and big letters, not just the political health reform, but the pressure for change is not sustainable. You can't make care affordable without using the wireless platforms.
I think you're right. So, besides being the host at mHealth Zone, I'm the CEO of Happtique, and, we're all about curating certification and prescribing of apps. And our clients, to start, are providers. That's what we're going after. And what we're finding is 4 months ago when we went to providers, it was different. Now, one of the first things they talk to us, because they're worried about readmittance, right? So they're starting to go, whoa, can I use mHealth to create better adherence, better outcomes, better engagement, to keep them back from coming in 30 days? So they're actually being forced to make decisions that, 3 or 4 months ago, didn't even want to put in their mix.
One of our pediatricians at UCLA came to me because we do more transplants than any place in the country. They have teenagers who have transplants who won't take their pills afterwards, and they have an app now that they've created to take a picture of the pill on the tongue of the teenager and then give them incentives.
See, I love that. And, it's amazing because one of our clients, we started to work with Mount Sinai, and Mount Sinai told us that, and they do a lot of transplants, they were saying that transplant patients have some of the worst adherence.
Yeah.
And me and common sense, you sit there and go, you give me a new kidney, I don't care what you say, I'm going to do whatever you tell me forever.
Have you ever had a teenage kid?
I have two. I have two freshmen in college. I have one in Chapman, and I have one in Indiana. And I know it. You tell them, and they're still not going to do it. And I'm not the best patient either. But you would think if.
I know, but that just demonstrates how great the need is. Just think about now if you're trying to get someone with mild hypertension to take their pills.
Right. But even mild hypertension, you would think the doctor sits you down and goes, this could lead to heart attack, stroke. Fear doesn't always work.
No.
Right? I guess that's why, a lot of people have diabetes and they don't do anything about it because, you can't just go in fear. So you're the keynote speaker this morning at the conference. Can you give us a little hint what you're going to be speaking about?
Well, basically what they have asked me to do is not talk so much about wireless, but the forces that are going to push the market in this direction. And what we're seeing is health systems, doctors and hospitals, and sometimes with health plans, taking down the cost of care by as much as 10%.
Really?
In major efforts. And they start often with their own employees. And they make their employees healthier by giving them screening and tests and coaching, walk in, see a doc or a nurse anytime you want to. It's not rocket science, but it's the absolute decision we have to do this.
Do you think physicians want to get this data? I mean, connected, if I give people apps and it's connected.
Obviously, if it's filtered in the right way. They're afraid at the beginning. Sometimes they're going to be overwhelmed. But the experience is with a good filtering system and alert system, it's totally appropriate and they like it.
How does an institution like UCLA cut through the clutter? I mean, because you must be getting bombarded every day by adherence apps, clinical apps, companies coming to you, not just devices, sensors. How do you cut through the clutter?
Well, we've hired an app guru to help us do that. So you see new people entering the workforce in the healthcare systems.
There's an app guru now.
Yeah. And we also have a wireless health institute and a whole bevy of people who are working on creating new apps themselves. So we don't just take the incoming missiles. We provide some.
But with that said, there's a clutter and you get contacted. So for people out there, as I was mentioning to you off air, like a third of our audience are providers, a third of them are in the, we'll call them the physician category, and the other third is in the developer side. Are you open to developers contacting the institution, and are you always looking for something new?
We are, but that's a setup. That's a softball that really we need something like Happtique to help us filter that kind of thing. And actually, as you know, we're looking at Happtique because you need some help in all of that. And we have an investor forum. We have a lot of activities that help us sort through it all. But if you look at the sheer numbers out there, it's pretty overwhelming.
But it's not impossible. If a good idea, so the cream will rise. And if it's a good idea, it will get to you guys and you will take it serious.
This morning I'm going to talk about the toaster test.
Okay. What is the toaster test?
Basically, the app has to be as easy to use as your toaster.
I agree.
If it is as easy to use as your toaster, we love it. If it solves a problem.
I'll give you the best example. So our CTO bought a withing scale, and he wanted to, started doing everything, walking, and he wanted to hook it up with HealthVault. HealthVault, great product, but it wasn't easy, and he's a CTO. So what you want this stuff to do is, if I take home that withing scale, I want to be able to step on it and really easy connected. If you give me a blood pressure cuff, I don't want to have to figure it out because I'm going to lose interest. And I'm a technologist. So what's my mom going to do?
Right.
So are you excited about the space? Like, where do you think the biggest change is going to be over the next 3 years?
I think the biggest change in the next 3 years is doctors and health systems are going to find out that patients can do a lot of this themselves with support.
So some of the onus is going to go on the patient.
Yeah, but I mean, we have to figure out what the patient's appetite and capabilities are. But there's really good evidence for 25 years that with a little bit of support, patients make huge strides in managing their own health.
It's amazing, Molly. It's an honor having you on the show. I've been a fan from afar for a while. I've heard you speak a couple times, and for everyone listening, this has been a pleasure. Thank you very much. Have a great rest of the show.
Thanks. Okay. Bye-bye.
Hey, so everyone, welcome to the show. That was Molly, and now I'd like to bring on Rob McCray, President and CEO of the WLSA. He's hosting the program. We're honored to be here because of Rob and his team. And Rob, he's coming on right now. Rob, how are you doing, my friend?
I'm good.
I'm actually.
How are you? You're gonna get that out.
Well, because we're on TV
view
today.
we're not just
the radio. So
God.
The mHealth Zone is moving up.
My shorts aren't showing,
You
are
could
they?
have been wearing shorts, right? And flip flops. We are in San Diego. All right. First question. How was first day of the show?
I think it was great. It was terrific. High quality. Having the peer review process means you have all quality and not so much arm wavings. So that's what this conference is about.
How many shows? How many years has this program been going on?
This is our third year as the Wireless Health Conference Series.
All right, so tell the audience, so many people don't know about it. We actually broadcast from one of your other shows. I think it was in May. Tell us about the Wireless Health 2012, and what is the goal of bringing these folks together?
So the goal of this program is to merge the technology and mathematical sciences and the health sciences. We aren't going to create the best solutions for health without a merger of those ways of thinking, the discipline of science, the systems thinking of science and mathematics, and the behavioral knowledge of healthcare.
So when the show ends and people go home, what are like the one or two things you hope that they walk away with?
I hope they walk away with the concept that there are real solutions to these human problems, but they are going to come by systemizing our thinking about how to deliver health services.
I was amazed yesterday at the cocktail party when I was walking around, the level of people and the diversity of people. You have people from Microsoft Labs here, you have people from Qualcomm, you have people from Quintiles here, you have people from pharma here. And a lot of developers. It's a very diverse group, which is exciting.
It is, and we have people from China and from India and from Europe. It's the whole range of organizations that are interested in the creation of solutions.
So what are some of the buzzwords you've been hearing, and expect to hear over the rest of the conference?
Systems thinking, big data is a big one. Nobody knows quite sure what it is, but they know it's going to be big.
Yep.
Lots of potential uses for it. Integration.
Yep. My favorite term lately is the term people have been using, like liquid data. And it's amazing. Last year at All mHealth, no one really talked about data. It was about apps and connectivity and what it does. And now finally everyone's like, well, if you create this connection, what are we going to do with this information?
Well, yeah. Another big buzzword here is evidence,
right.
And we've had 2 discussions already on it. And because we have to establish as quickly as possible which of these innovations work in the real world with real people. Because if they don't work, if they don't change the needle on outcomes and health outcomes, then they shouldn't be out there.
It's funny. With my Happtique hat on, we talk a lot internally, and we talk to clients a lot about. Everyone gets the concept of all this connection and devices and apps, but everyone still is asking the question, what's the data? Show me. What percentage of people are using it? What percentage works? Where is it coming from? And it's great that people are actually at a conference here actually talking about that. And it's, I was at Health 2.0 a couple weeks ago, and that's not what they're not talking about the evidence. They're talking about, here's something cool, and this is how it works, and it's pretty cool that we're trying to figure that out. As President and CEO of WLSA, your mission is to improve access to affordable, high-quality healthcare by accelerating wireless innovation. How are you going to measure success?
Well, I think there's another component to it, and it's a big part of our belief in the future and how we bend the curve on health outcomes and costs, and that's by empowering the consumer,
right.
To engage the consumer as consumer, not as patient, to manage their own health. That's where the first responsibility lies. We're building the tools now to make it easier to actually discharge that responsibility. And I think socially we have to have a conversation that returns all of us to the notion that, well, we got to take care of ourselves. Can't rely on the health services industry or pharma to fix every problem, especially those that are self-created.
What do you think the biggest changes are going to be over the next 3 to 5 years?
Well, 3 to 5 years, we're going to be beginning to see tools that can work in the hands of a consumer to provide diagnosis. I think we're going to have access to essentially free heuristic diagnosis, the diagnosis that now occurs when you sit down with a physician and go through your H&P and your symptoms, because we can systemize that, we can organize it, we can make it accessible, we can make it accessible for free via any connection, and really take a lot of the guesswork out of figuring out where to go. Do I need to go to see anyone? If so, where should I go and what questions should I ask and what questions should they ask?
And in 5 years from now, when I come to this conference, what do you hope that's going to be going on?
You're going to be picking up at this conference, at Convergence Summit, I'm sure at others, you're going to be picking up handheld devices that provide, with sensing and data and maybe a little bit of history from yourself, diagnosis on hundreds of potential diseases.
So you're excited about the future?
Absolutely. We're creating it. We're transforming how health is. I think we're returning to a world where people have more responsibility. They discharge it, and they have access to knowledge.
So you sit in a unique perch. Tell us some cool things that have come through that you've seen that sort of get you excited.
Well, right now, I have to say that one of the things that gets me excited is seeing the early technology around handheld diagnostic devices.
Give me an example.
Scanadu is coming out with their Scout, and I've seen some early versions of that. Of course, the Tricorder X Prize that Qualcomm is doing with the X Prize Foundation. We are going to see real devices that are able to, not quite as good as on TV, but give you real information about, what is wrong with you.
One of the things I've noticed at this conference this time and the last one I attended is I think the industry is maturing to a point because it's not just, garage startups or some guys who got a couple $1 million seed funding. It is the big guys who are for the first time, who might have been device guys, or they might have been just pharma guys, or they might have been, Qualcomm, which really isn't healthcare. They're coming into this space. Do you see that?
Well, the big guys are coming into the space, and also a lot of really innovative people are leaving the big guys, and they're creating the small companies, which is the tried and true method for creating technology startups, right? So you're in Ericsson, or you're in Philips, or you're in GE, and you leave and you start something and create a product or a service that those companies may not do, and then they buy it back eventually, right, if they consolidate it. So we're seeing that. One of the other ones, if you ask me just who I'm excited about, is dual fertility.
And what does that do?
Dual fertility is a substitute for in vitro fertilization. It works basically as well without any visit to a physician, without any invasive procedure, and it costs about 1/10 as much. It's available directly to consumers in the UK and now in the US.
All right, so how does our audience find out more about WLSA and what's upcoming programs?
So there's a couple things. Our Convergence Summit is next May. That's the oldest program we've done since 2006. WirelessLifeSciences.org is our website. We also just announced on Monday a new site. It's in beta format right now, connectedhealthworld.com. It's free to the world. You register, you post your product, your service, your application, your RFP, your grant opportunity, your need, and we're creating a global marketplace open to everyone to find those who have solutions for those who have needs or money.
So it's a B2B marketplace.
It's a B2B marketplace. It's helping people find each other, but it's curated to the extent that we will go through a registration process and make sure that it doesn't become Craigslist for widgets. It has to be quality.
I think it's important. There's not a lot of places for people to go.
Well, it's similar to what you're doing. We aren't going to curate it to the extent of Happtique, but it is a similar model. But let's make the world more transparent. That's one of the most powerful sources. In 5 years, I think another thing we will see is we will see more transparency about the costs and the outcomes and the quality of services delivered by various healthcare products, devices, services, therapeutics, and that will really inform this consumer movement as we have more responsibility for how we spend our own dollar.
Yeah, I actually believe that also with so many baby boomers turning 65, they're pushing for this because they want to stay in their homes. They don't want to go to senior citizens. They want to be connected.
They have more disposable income than any other generation in history. They're bigger than any other generation in history. They're more selfish than any other generation in history. They want to stay home. They want to be healthy. They want to be active. They are not going to go to the nursing home. I think that we are, as I'm one of those, we will be living with a robot before we move into an assisted living center.
I agree. My last question to you, okay, you're based in San Diego. Why is so much of this mHealth innovation coming out of San Diego?
You know, we just had a nice network. We had some life sciences thinking here. We had Qualcomm and the best wireless telecom sector in the world, perhaps. We had some of us who understood kind of and saw where the connection between technology and healthcare and communications technology would be, and we started this process. So that's how you get the network effect going. And we're part of California, which has a wonderful innovation history.
Right. And I actually think, like with Scripps being here, it sort of helps for the whole marketplace.
We've got, that's right, that's part of the ecosystem. Right here on the Mesa, we have 80-some research institutes, all in health.
It's exciting. It's been an honor to be at my second conference. I cannot imagine not being at the next one. Hopefully we'll do the show from there. And
do it again.
Thank you so much, my friend.
My pleasure.
All right, good rest of the show. It's really exciting. My next guest, I'd love to bring him on right now. And what's really cool about it is about 7 months ago, I was at a conference in Laguna at the Ritz-Carlton, not a bad place to be. And him and I were like just standing around, and we started talking. And who would know that, 7 months later, he'd be on the show. Come on in. And how are you, my friend?
Good to see you.
You know what's funny? Your company is... Everyone's talking about. First, introduce yourself to the audience.
It's great to be here. It's Kian, Saneii. I'm the CEO of Independa.
First of all, Independa is one of my favorite concepts of companies. It actually ties into the last question I was asking Rob.
It does.
About, these baby boomers, these 8 to 10,000 turning 65 every day. They want to stay in their home. You were one of the first in the space. My first question, tell the audience a little bit about your company and how you came up with the idea.
Sure. So the idea was pretty simple. 30 years into it, we still had I've Fallen and I Can't Get Up as a brand for technology to help the elderly. So the concept was, how come we haven't done better, done more? And you heard Rob just talk about how there's a innate desire to stay independent in your home. It could be even a resident. It could be an independent living versus assisted living. And so technology really wasn't playing the right role. And when we looked into it, the idea became pretty apparent. There was a lot of point solutions.
Right.
So everyone's touching this elephant from their vantage point. There's markets around cognitive tools. There's markets around telemedicine. There's markets around telecare, remote monitoring. There's markets around having a computer or some device that helps the elderly person finally get engaged socially. And so we put it all together as a single shop where you go to set thresholds so you're notified when something isn't quite right and bring it all together.
What I think is really, there's other companies who are going into the space that you're in. What I always thought was really intriguing about you, you're not an app.
That's right.
It's not an app. It's not an adherence app. It's not a monitoring app. But you also enable to bring in other technologies into the system. I mean, I don't know if the right word is system.
You know us very well.
But that's what intrigued me about it. But most people who I see in the space are like, this is our app. This is the only way it works. You got to use ours. It's
right.
Click here if you take your medicine. Do this. Let grandma send information.
Sure.
How did the brain child come to go, we're going to open it a little more and you're going to partner?
Right. So we knew in order to have everything, we had to choose what to be great at. And we wanted to be great at as a platform, to your point, as a service. So we're a platform that sits in the cloud. We call it the Independa Integrated Cloud Care System. And we integrate with various hardware providers,
Right.
so you can have best of breed of your choice, whether it's, we integrate with the Great Call 5-star pendant,
Right.
which is a fantastic device for personal emergency response. We integrate with Ideal Life for a set of telemedicine apps. We integrate with Telcare, for instance, as a best of breed, Qualcomm,
Right.
The TuneNet platform, et cetera. So right off the bat, you're not tied into any single platform and you have a choice. So that's one aspect of not tying someone in. The other aspect is really as a platform, you want to be able to become the strategic infrastructure for a large company. So typically what companies have done is they address a caregiver and a care recipient with their app. What we've done is we've addressed an enterprise
Right.
partner. So we are a B2B2C. In other words, it could be an insurance company, it could be a facility, senior living facility, independent assisted living, or it could be a home care company. And they have roles such as a care manager, they can monitor, et cetera. And the key to all this is they empower the circle of care around the care recipient. So there's already a family member or more, neighbors and friends that are taking care of someone based on their desire to stay independent. That hasn't been leveraged in the system. There's really been never an opportunity to leverage all that goodwill and good effort to come back into a health insurance company that says, I'm going to reduce my costs and improve my customer satisfaction by having a system that allows other people to take care of my members.
So the stars are finally aligning in a way.
Well, I think the stars were aligned. We just had to do it. You know, people have to do it. I think it's not rocket science. We have to just provide the services.
So earlier on the show, I had the Chief Innovation Officer from UCLA, Molly.
I know her well. She's phenomenal.
And one of the things she brought up, she said the key
Yes.
is going to be ease of use.
Exactly.
And I can't think of an audience that needs easy use more than, senior living. I'm just thinking about my parents.
Yep.
And, once you teach your parent how to text, they text a lot, but it's got to be really easy to do.
Right.
What's your company's thought process on making it easy once it gets into the home?
Well, really, it's exactly right. It's not about feature function benefit. It's not about the sort of an IT view or a consumer, cute Health 2.0 or Web 2.0 application.
Right.
It really is about ease of use. And we actually founded the company on the shoulders of IDEO, the design firm, who came up with exactly that sort of DNA infusion into us, that it was not about what you do, it's how you do it.
Right.
And the prospect for us was we have to make it innovative, but yet it has to be inviting.
Right.
So that the inviting part is what you're talking about, Molly's talking about, and what we've gone to market with. Has to be super easy to use. In fact, we've used 2 different design studios as we keep building our product, and we're going to continue to do that because it really has to be super simple, super fun. Otherwise, nobody wants to be old, nobody wants to be patronized, and nobody wants to sort of be big brothered. And those are some nuances that typically don't exist in other markets.
So what would be a typical setup in a senior's home? Like what's needed? How does it, how does it get started?
Sure. So
is it coming in like a dump truck of supplies or?
No, it's actually very simple. The tools that a senior knows how to use are the telephone and the television.
Okay.
So right off the bat, we integrate with those two. And we're unique, I think, in the sense that nobody else has a senior TV. We're the world's only senior TV. LG has invested in us. They're a strategic partner, and we're going to market with the LG commercial TV so that you can replace your TV, watch the content you're watching, but then your granddaughter could be doing video chat with you right on top of Matlock, and you could say yes using your remote control, or you can go to email, to Facebook, your health information, picture frame mode. People can put up photos for you.
It's giving them smart TVs. It's smart technology.
And smart technology is different than what we hear as smart TV because it's not an app on a deck.
Right.
We actually come embedded inside the TV. They actually changed the insides of the LG television back in Korea as a global SKU to run Independa as we go to market. So that's a big deal, right? So that's the easiest, simplest, no training required. Use your standard remote and get the benefits of social engagement. By the way, is the number one issue for the elderly.
Right.
So it's not medication, it's not falls. It's actually getting depressed from being socially isolated. So that's number one. The other one is the telephone. So let's say you're out of the house and you can't say yes to the med reminder. You end up getting a phone call and getting reminded. Also, you can get activities of daily support through the phones. You can actually record life stories using a phone. So it's a holistic view. And we also run on tablets, by the way, uniquely.
Right, but I think that it's one of the keys that I'm hearing here, besides keeping it in the way I want to be, use it. Right. If I can use a clicker and I could use a phone, I could use it. If I want to use a tablet, I could use a tablet. But there's also human intervention too. So it's not like it's all technology and it's all automated. You have physical or there's an outreach. There's a human being on the other side somewhere.
Exactly. So the human intervention is really on the caregiver side or the care manager. So those are two roles in our system where a professional can set up these thresholds for you. So you may have comorbidity, multiple chronic conditions that somebody is checking over time for you. And so you may have to, let's say, step on a scale
Right.
and take your blood pressure, maybe take your pulse ox. And so these are thresholds that now you can automate and say if it goes past a certain level or below a certain level, set up an orange
Right.
alert, a red alert, a yellow alert, et cetera. And people get notified and there's escalation and so forth. But from a senior's perspective, what we call the care recipient, because by the way, it doesn't have to just be a senior.
Well, I was gonna ask that.
Could be a mental or physical disability, could be autism spectrum. There's a lot of applications to what we call supported independence.
Right.
To do supported independence, you really have to have a holistic view of all these. But somebody on the outside is setting this up, so you don't have to worry about anything. You don't have to go into a system. Again,
Right.
that goes to the ease of use. You don't have to know anything about computers.
From when you started the company to now,
Yes.
are you amazed at how far technology has gone, or are you sort of a little disappointed on how far it's come?
I think we're just starting, actually. I think, our view is we leverage what's out there, and what's out there is getting much more exciting. But I think we're just starting to see the future where you have patches and you have smart pills, et cetera. And by the way, for this to be really meaningful, it has to be global
Yes.
from our perspective. So, we're not the only ones with aging. Japan is, China
Right.
is, all of Europe is, et cetera.
Right. So, who do you think is a bigger driver? Are the seniors asking for this, or is it the medical community saying, "Hey, I need a better way to monitor the senior population"?
I think every role in that sort of triangle between the care recipient, caregiver, and the professional has its own value prop.
Right.
Senior living facilities are driving for this because if you stay in an independent living facility 1 month longer than go to assisted living, they make more money and their customers are happier. Family caregivers are obviously driving for this because it reduces their costs and anguish.
Right.
Companies are actually driving for this because they have presenteeism and absenteeism with the caregivers taking care of parents. Health insurance is driving for this in a big way because they can reduce the costs overall and they can actually have visibility to someone before they show up on an ER. So it really fits everyone's goals, short of, frankly, to be honest, hospitals just yet.
Right.
Because hospitals would drive for this as ACOs and transition care,
Right.
but after 30 days, there's no strategic incentive to keep
Right.
you away still. So maybe at 60 days, over time, I think as you really want to keep people healthy, you want to keep them where they want to be, which is where they are right now, wherever that is.
What's the feedback from the patient populations that's using the technology?
So in our world,
Yep.
we have no patient feedback because
Right.
we don't have patients.
Right.
So we are really just outside of our system. And so a senior living facility, for instance, doesn't have patients.
Right.
They have what we call care recipients or
Right.
residents. But the feedback is excellent because the key, the desire is to stay independent. Anything that helps you stay independent, people drive towards. And there's an interesting aspect to this that the elderly don't want to be a burden to their loved ones.
Right.
So if they can get a call that reminds them to take a pill, they'd rather do that and that versus having their daughter call them to remind them to take their pill. They'd rather have a quality conversation. So it's an interesting aspect
Right.
that you and I maybe don't appreciate just yet. But over time, that allows them to have quality conversations and quality interactions with their loved ones.
What are 2 or 3 things you expect over the next 5 years from this industry?
I think, if we're talking about mHealth and we're in the wireless life sciences, I think at the end of the day, the technology doesn't matter.
Right.
I don't think we worry about how, the different components in a car are working. It's some higher levels of the car that we care about. Same thing, we shouldn't worry about how the technology works for an elderly person. It's about whether they enjoy using it and whether that becomes commonplace. So that's one area. Maybe 5 years is too early, maybe 10 years, but I totally agree with Rob. I think robots are going to be a big part of this. I think it's very simple to have some robots do some, basic care management, which sounds cold, but actually in the absence of someone else,
Right.
it's very effective.
If someone out there has an idea, so is Independa open for collaboration with new upcoming companies that might have an idea that they think should be part of your care continuum?
We're open in general. We're also, I have to say, very focused. So we have too much to do and too little people. But at the end of the day, we have some great partners that are on deck to come on board. I'll mention, for instance, Coye Health is a great one. They have a whole collection of 3,000 sermons and music therapy. So we can't be in that business. They already are the best of breed. So we want to integrate with them for the elderly. So in that vein, we're very interested in partners.
So besides monitoring adherence, the engagement portion isn't just my medical and health; it's entertainment too.
Huge part of it is entertainment. Certainly, as Rob was mentioning, all of us and the elderly today, there's nothing wrong with wanting to enjoy life, and that's what we want to do. Gamification of certain aspects would be great as a potential partner, and just games for the elderly, cognitive tools, and so forth.
Bingo.
Bingo,
virtual
exactly.
bingo.
Bingo and bingo.
Bingo and bingo. Exactly.
Solitaire is a big one. Mahjong is another one.
That's right.
Scrabble.
It's funny because I thought I had a really good idea about your company, but when you think about it, you're more than just, hey, monitoring is important, but it's about them aging in place and what is going to be needed and what are they looking for, and they want interaction.
If it's about health
Yeah.
and not about CMS codes and sort of taxpayer subsidies on payments, the number one issue is social engagement. That's why we've missed the boat culturally here and many other places around how to address aging in place. It really starts with social engagement. But there's no code for social engagement. There's a code for chronic disease.
Yep.
There's a code for falling and breaking your hip. So you have to start from there, to your point, and that follows with a lot of other benefits. But if you don't start there, it's hard to sort of imagine somebody loving to take their blood pressure on time and loving to step on a scale and loving to press the pulse personal emergency response.
It's just about making it easy and making part of their everyday. My last question for you. I ask everyone this question. What's your favorite app? It does not have to be a healthcare app that you think is really cool. Use it either makes you more productive or you have fun with it, or it could be a healthcare app.
Well, I'm not just saying this, but since I'm sitting here as I think, your app is awesome. And you're, what you're doing. What you're doing is bigger than an app. It really enables so many other apps and makes things happen. And we need more and more of that. So, similar in a way to what we're doing across different modes for the elderly. So. I know it's going to be a huge success.
All right, last question.
Another one.
I know, I'm lying.
Second
to
favorite
you.
app? Okay.
No, not second favorite. Well, you can tell me what your second favorite.
Well, I like AliveCore.
Okay.
I think
Dr.
that's
Albert rocks.
Yeah, exactly.
He's like the most amazing.
I like the fact, beyond what it does, which is great and incredible, I like the fact that it's really changing people's perspective, that you can have doctors like Dr. Leslie Saxon who sit there and monitor some things just in a consumer environment. And we were at her body computing conference, and of the folks that Dr. Albert was monitoring, one of them had an issue with his heart, or her, I'm not sure. And I'm sure they intervened and had a chat with them later. So why not do this, across the board using a simple tool? So I'm excited about it.
Super excited. All right, last thing, not about apps.
Yes.
What's the next thing we expect? I love seeing stuff about your company in the news. What can we expect next?
Well, we're in multiple pilots as we speak, so we're keeping those under wraps. And between December and January, we're going to make some announcements around some of those customers. And I think certainly our goal is to be game-changing in how some of those partners that we talked about can have a better business using our tools and our infrastructure.
I'm sort of a betting man, and I'm betting on your company. I'm a huge fan, and keep up the good work. It's amazing.
Feelings mutual. Good to see you.
It's great seeing you.
You're a Renaissance man.
Yeah, exactly.
I'm behind the radio too. Thank you.
later.
Good seeing you. Bye now.
Oh, wow, that was awesome, man. This was so much. This is the best part about this gig, is getting to meet these amazing people, which kind of leads me to the next one. Here's an amazing thing. So Dr. John Mattison is Chief Medical Information Officer at Kaiser. What's pretty amazing, I was on a panel with him a couple months ago, but I never got a chance to talk to him. And here's my first opportunity to talk to him is on the show. So like I was saying, one of the coolest parts about this gig is I get to meet really cool people. So, hey, Dr. John Mattison, welcome to the show. Come on in. How are you?
I'm doing great. How are you? Good to see you again.
It's amazing seeing you. Hey, will you just introduce yourself to the audience and tell them a little bit about your role at Kaiser?
Sure. I'm the Assistant Medical Director and the Chief Medical Information Officer for the Southern California region, which includes over a third of our entire program. I also am deeply involved in the oversight of all of our technology in the region, and at the national level, our investment in new projects and innovation projects.
All right. So, what is your organization working on right now? Always cool, innovative stuff comes out of Kaiser. So,
what are we not working on right now is probably the best question. We have literally scores of innovation pilots that we funded across the program, every region involved. We're working with various mobile, social, gaming, We actually have some early pilots we're using with avatars for motivation. And so the big opportunities ahead really are deeply steeped in the behavioral sciences and how we motivate people to lead healthier lifestyles.
Are you finding at Kaiser that is it the patient population that's demanding it? Is it the doctor population that's demanding it? Or is it just the cost of healthcare and the bigness of healthcare that's driving it down this road?
Well, the way I like to think of it is the combination of mobile, social, gaming, and all of the digital revolution, it represents the most disruptive change and opportunity in the history of healthcare ever.
Right.
And I think that the key here is to understand that we can't move through incremental change. There's some very revolutionary things that are happening. And so to the extent that we can change our entire model of care from one that's based where the physician lives in the clinic and the hospital to one where the patient lives, where they live, work, and play and study and worship, that to the extent that we can take healthcare wherever the patient is really transforming the whole frame of reference for healthcare.
So your patients have access to their EHRs mobilely?
Yes. We've really pioneered the personal health record online, and we have between 60 and 70% of our eligible members use their personal health record on average 19 times a year. There's over 20,000 emails between our patients and our physicians every single day. And so what we've done is we've mobilized those services so that they have the same level of service in their hand wherever they are, anywhere in the world. And the transition from web-based to mobile-based platform has been incredibly rapid and explosive. And now what we're trying to do in addition to those services is to bring the behavioral support to help patients achieve their own personal health goals.
Are you amazed by how high the access rate is? Because that sounds a lot to me, 19.
We've worked very hard to motivate our members and enroll them in these services. Once they discover them, they're hooked for life. So the getting everyone to sign up is sometimes a challenge, but once they realize the kind of service they can have, it becomes viral among their social network.
And also based on number, if 60-70% of the patient population is using it, it crosses all age categories. So it's
Absolutely.
it's not a under 30, it's not a senior. So is that surprising too? I mean,
well, there's a great misconception that older populations are less inclined to adopt technology, and in fact, the largest growing population on Facebook today is actually the elderly.
Right.
And part of the reason is because everybody under 40 is already on Facebook, so it's the only opportunity, but it's growing extremely rapidly.
So you're giving the keynote today. We tell the audience, this audience, is not going to get a chance to hear the keynote. What's the keynote about, and what do you hope this audience physically here leaves with?
So I really like to think about where is this all headed? Where is big data and mobile and analytics and behavioral support? Where is it all going? And the way I like to think of it is that the mobile device is going to become our personal universal communicator with people and things near and far. So it's going to be everything. And the flood of information that we're all inundated with is only going to continue to grow exponentially. And as it grows, we need much better tools for understanding what's relevant to us and how we can adapt our lifestyle to achieve our personal health and wellness goals. So to that extent, there are going to be multiple avatars that every one of us interacts with to help us manage that flood of information and what we choose to do. The big challenge to me is around who owns your avatar and what do they want from you. And so there's something that I call the black box economy. And the black box economy can be best illustrated by what happened in the financial world, where a simple tool called credit default swaps led essentially to the downfall of the economy. And there was no transparency into this. So what I'm hoping to do is bring about a level of transparency into who owns your avatar, what they want from you, and how decisions that you make are supported based upon your values and objectives rather than those of whoever owns and provides the avatars to you. So I think the big challenge is as we begin to see very sophisticated tools for managing our data and our behavior, how do we ensure that the values and objectives of these avatars that are going to be guiding us are aligned with our own?
I think that's That's fascinating. And I think it's really cool that you're one of the first guys who've actually stood up and talked about data. I thought to me, you know, being part of this whole mHealth space, everyone talks about apps, everyone talks about devices, everyone talks about sensors, how it's going to change healthcare. But you're one of the few who really stood up, even in the beginning, was like, it's about the data. And what are we going to do with the data? And not data for data's sake.
Right.
And so who do you think should, just on a personal thing, who owns the data? Should it be the patient? Is it the institution?
So that's a really good question, and it's often posed as an either or, but it's really a both and. So the healthcare professional has a legal and ethical obligation to maintain high integrity of those data in the service of every consumer. The consumer has an ethical and legal right to have access to all this data. So I really see it as both and I believe that there's going to be a significant role for an expansion of personal health records to the extent that individuals want to control their own data. The personal health record is going to be the vehicle for doing that. But the professional still has the legal and ethical obligation to retain everything that influences their decisions.
You know, our audience is broken up. About a third of our audience are like CTOs, CIOs, CMOs, CMIOs of hospitals. What advice would you give to the audience as they start? Not everyone's where Kaiser is. Not everyone's as innovative as like UCLA is. Where do they start? What should they think? What should they be thinking about? How do they get involved? They can't fight it. They can't hide it away from it anymore.
Right.
What's some advice to them?
I think the most important thing to realize is sort of the lesson of Kaiser as a whole, and that is that integrated care and integrated delivery offers opportunities that are unavailable absent that level of integration. And the same is true of your mobile strategy. So to the extent that there's over 13,000 health and wellness apps in the Apple App Store, to the extent that the uptake is fairly limited to date, there's a signal in that noise. And the signal, in my view, is that there isn't a sufficient level of interoperability at three levels. One, modular architecture, open architecture. Second, at the semantic interoperability, both between the health record data, the personal health record data, and the app data, as well as between the consumer terminology and the professional terminology. And the third level is behavioral interoperability. So the problem we have today with the disorders of lifestyle is really centered around behavioral issues. And so to the extent that we can create a behavioral symphony of wellness that helps bring about convergent cues so that it makes it much easier for us to do what we want to do in achieving our own personal health and wellness objectives. And so there isn't going to be a single killer app. It's going to be an ecosystem of apps that interoperate at those three levels of platform, semantics, and behavioral interoperability. And so as you think about creating your solution set and your strategy, I think it's really important to look at the interoperability and the ecosystem approach as opposed to the killer app approach. And that's why I've been very active with the Open mHealth initiative. I've recently joined their advisory board because I believe that they're at the leading edge of creating the foundational standards for interoperability amongst different health and wellness applications.
So, you know, as a physician, why do you think a lot of physicians are not jumping on the bandwagon of getting involved in delivering apps or, you know, mobile health to their patients? What's the hesitation?
So there's a misconception that's urban legend that physicians are reluctant to adopt technology. I think you can go into any operating suite in the world and see that they embrace new technology very quickly. The challenge is that operationally, they're under such extraordinary time pressure. And what's happened with this exponential growth of data is there's what Peter Diamandis of the X Prize calls the disruptive stress gap. So what's occurring today is that there's more and more demand on every physician at every encounter to accomplish more and more stuff. And so they're kind of overwhelmed with the incremental addition of new stuff. What we're talking about in the mobile digital revolution is transformational. And so we're not going to get there incrementally. And so in the mind of the typical physician, they're stuck in how do I incrementalize this thing? And it looks like mobile apps are going to represent more work on top of the incremental adds as opposed to a disruptive change that can substitute for some of the work that occurs where the physician lives and push some of that out to where the consumer lives and actually decrease the disease burden and the demand on services. So this really is a disruptive change, and there will be a tipping point, but we're stuck in the incremental mindset at the moment.
So with my Happtique hat on, and you know, we believe in, you know, certifying apps and curating apps, but we really are all about prescribing apps. Do you think the day is going to come when institutions will have an app formulary and physicians will be prescribing. And when I say apps, I don't mean just apps,
Absolutely.
connected devices.
And we actually have a project called Designing the Office of the Future and Primary Care Redesign. And there's a lot of focus around telemedicine, which I think is an utterly obsolete term. And it's my belief that instead of having a telephone in every exam room in every office, there would be full video capability. And there are already institutions that are doing this, and we're working on it. So there's no need to think of this other than video dial tone instead of conventional dial tone, to bring together the patient, their mother, their personal caregiver, their cardiologist, and their physician real time.
Love it.
And that's going to be profoundly transformational. To your question of what are we going to do with the app prescriptions, I believe that the significant new role that must occur within our walls, more or less, is when you prescribe a suite of apps for an individual that fits within this ecosystem, you need to get them initiated. Once you get people initiated to apps that have a good behavioral framework, they will stick with it. But I believe that we need to have the capability in the office, when the apps are prescribed, to set people up on their smartphone or smart pad with the apps, get them started on it, and then with each return visit say, how is it going, review, and then begin to mass customize the behavioral levers within each of those apps to drive them towards the behaviors that support their own personal goals that they commit to.
I agree 100%. It was like music listening to you say that. My last question for you, what's your favorite app? And it doesn't have to be a healthcare app. I ask every guest I've ever had on the show, what are you into these days?
By far and away, Pandora. And there's a book called Musicophilia that describes how our brains are so attuned to the appreciation of music. And what Pandora does, if you don't use it, is it's called the Music Genome Project. It allows you to create your own music stations. And to the extent that it's mass customized to me, it represents one of the early progenitors of avatars. And so what we're going to see is multifunctional avatars across our entire interaction with the universe. And Pandora, I think, is really a forerunner of what's to come in healthcare and essentially every vertical. And these will become the primary sales and marketing channel for everything. And so that's why Pandora, to me, because of the music aspect, is my favorite app. It also represents, I believe, the future of all communication through mass customization.
Your passion is amazing. I'm like awed to be able to interview, and thank you for being on the show. Have a great rest of the show. And my last question, so for the audience knows, at Kaiser, are you open to, there's developers who listen to our show, and are you open for new ideas? I mean, does Kaiser look, or is it like we have to build it ourselves? I mean,
so I wrote an architecture for our mobile strategy about 4 years ago, and one of the key assumptions is that there are too many there are certain foundational things architecturally and those 3 levels of interoperability that we need to maintain, and we have the big data resources to do the mass customization. But it's my belief that our app store is going to be predominantly composed of apps that conform to our architecture and the semantic and platform and behavioral interoperability framework. But I expect that the majority of apps will either be co-developed between us and our many strategic partners in the space, or that when they're compliant out of the box, we'll plug them into our ecosystem. So I look forward to working with many, and already do, many of the early innovators in the entrepreneurial space.
All right, so I got to ask you this. I said it was my last question, but I lied. Yeah, so 10 years ago, you're a physician doing your physician stuff. How does this happen? How do you transform from being, this really good doc to, innovation, technology, I'm going to start spending, a majority of my time on? How did it happen? What was the transformation?
Well, I come from a long line of serial innovators, my father and my grandfather, so this didn't happen at some point in time. What happened personally, and if you Google accidental informaticist, you find me, because I was pretty much drafted for this role, and I had done some coding and early modeling of an ecosystem way back, but fundamentally, I was drafted to do this work and really bring about some coordination and integration of our strategy and our approach. And what I quickly discovered is that interoperability is foundational. And so I've spent a lot of my career in the interoperability space.
That is awesome. I want to thank you for being on the
Oh,
show.
my pleasure.
Have a great presentation, and have a great day, and thank you so much.
Thank you. My pleasure.
Hey, so everybody, thank you for participating in the last 2 days of the mHealth Zone. It's been an honor broadcasting from the WLSA show. You know, one little anecdote I wanted to ask him about, but we didn't get into, which is kind of interesting, is he always wanted to do this. And what's amazing, and he always liked technology, but you always hear the story in this space. It's like the guy who gets the job as the innovation guy in an institution is he knew how to program his iPad, or he was the first guy who knew how to create a song list. So he was the techno geek, and they kind of drafted him in. But he had that internal passion. I think one thing we learned over the last 2 days is there's a lot of amazing people there out here who have amazing passion. And so my business for today is I need to let everyone know that our upcoming shows, the mHealth Zone is broadcasting live at the Connected Health Symposium tomorrow, Thursday, October 25th, and Friday, October 26th at 1:30 p.m. Eastern, and that's 10:30 a.m. Pacific. Tomorrow's guests include Holly Tecco, CEO of Rock Health, Ahmad, President and CEO of Mattison, Dr. Daniel Sands of Harvard Medical School and co-founder of and immediate past president of the Society for Participatory Medicine. And on Friday, one of my favorite people in the entire world, Dr. Kavadar, will be on the show with Corey Ackerman. He's the founder and director of the Center for Connected Health. Chris Wasden, Health Strategy and Innovation Practice Management Director at PwC. That's going to be a really cool interview. And Dr. Adam Darkins, Chief Consultant for the Telehealth Services of the U.S. Department of Veteran Affairs. And like always, I want to give a huge shout out to Miriam and Sarah, our producers. Without them, we never would have had this show. And for Nick, not only our cameraman, but our producer on site, I want to thank all you. I also want to thank Molly and Rob from WLSA for allowing us to broadcast from beautiful La Jolla and from this conference and allowing us access to their guests. So please reach out to us, tweet at us, and we're looking forward to seeing you live on the air tomorrow.